This is a CJSON podcast, and I'm Nora Franceschini, a professor at the University of North Carolina, Chapel Hill. With me is Kaylia Reynolds, a biostatistician from Boston Children's Hospital and the first author in the paper Circulating Metabolites Associated with Albuminuria in a Hispanic Latino Population. Metabolites are small molecules that can capture dysregulated metabolic pathways before disease diagnosis. Individuals with proteinuric kidney disease have shown metabolic abnormalities such as altered blood lipid levels. In this study, we are interested in characterizing metabolic profiles in individuals with mild albuminuria, which is more prevalent in the general population and has been less studied.
We studied 3,736 Latinos from the Hispanic Community Health Study of Latinos, a young cohort with a low prevalence of diabetes and chronic kidney disease at enrollment, and with an albuminuria prevalence of 12%. Metabolites were quantified in fasting serum through non-targeted mass spectrometry analysis. Among the 640 metabolites we tested, 148 were associated with urine albumin to creatinine ratios. This included 87 lipid and 29 amino acid metabolites. We replicated 20 of these metabolites in additional studies, including 18 associations discovered in this study. Among the replicated metabolites were 1,5-anhydroglucitol, mannose, and glucose, which are metabolites related to glucose dysregulation and type 2 diabetes. Of interest, pathway analyses uncovered D-glutamine and D-glutamate metabolism and arginine biosynthesis, pathways that have been reported in diabetes and insulin-resistant states.
We're also interested in learning about metabolite signatures associated with albuminuria and use machine learning approaches to combine correlated metabolites. This approach identified two modules significantly associated with albuminuria, both including mostly lipid metabolites. Pathway analysis applied to metabolites revealed biosynthesis of unsaturated fatty acids, alpha-linolenic acid, and linolenic acid metabolism for one of the modules. This includes essential lipids and precursors of arachidonic acid, which have roles in kidney physiology and inflammation. The association of this module was not significant when adjusting for diabetes and body mass index.
Considering that our study only had a 16% prevalence of diabetes at the visit when metabolomics was measured, our findings suggest that metabolomic pathways related to glucose dysregulation are associated with mild albuminuria even among participants not meeting criteria for diabetes. Our findings also show dysregulated lipid profiles related to inflammatory pathways that may be a consequence of glucose dysregulation.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.